So today we're going to talk about some common questions that come out about vitamin B1 deficiencies. Now, what the heck is vitamin B1? Vitamin B1 is better known as thiamine. And thiamine is incredibly important for energy production. In fact, the B vitamins in general are called the energy vitamins for a really good reason. And thiamine is a common B vitamin that's present in actually a lot of foods. But most people, back in the good old days, actually got most of their vitamin B1 from grain products. Now, as grains are milled and the hull and the germ is removed from grains, all the thiamine is discarded. Same way with rice. Brown rice has thiamine. White rice doesn't have thiamine. And there was a deficiency of this lack of this B vitamin called beriberi, which was causing skin problems, failure of eyesight, brain development problems that was traced to white rice consumption and grain consumptions that had been refined. So what does the government do? If you'll notice, most of your cereals or breads are, say, enriched. Enriched means we took away all these B vitamins and now we're putting them back in, which, if you think about it, doesn't make a whole lot of sense. But you're looking for those B vitamins, particularly B1. So why be interested in B1? Well, you may see on TV a lot that people, as they get older, are suffering from peripheral neuropathy. Your hands and feet kind of get tingly. They kind of get numb. And many people, my patients included, complain that they often don't know where their feet are anymore. Why is that? Now, certainly a number of my patients, this is caused by diabetic neuropathy, where sugar in their blood literally destroys their neurons. But what's interesting is it could be a B1 deficiency, vitamin B1, thiamine. So who could this happen to? First of all, if you're a drinker, most people who consume alcohol on a regular basis are thiamine deficient. In fact, if we have an alcoholic who we admit to the hospital and we're trying to prevent DTs, delirium tremens, the first thing we do is we give them IV thiamine in large doses because they are profoundly B1 deficient. One of the things that surprises my patients who have been told they have neuropathy and even who have been tested and shown to have peripheral neuropathy, giving them thiamine in a form that I'll talk about in a minute, 50% of them dramatically improve just by adding thiamine back into their diet. Another question I get about, am I tired all the time because of a B1 deficiency? Well, again, B1 thiamine is incredibly important for making neurons work. And obviously, your brain has the largest deposit of neurons. And so a thiamine deficiency can, in fact, cause you to be tired. On a similar note, a thiamine deficiency can absolutely cause brain fog or trouble focusing. As I mentioned before, if you drink alcohol, particularly if you're the type that likes hard liquor, booze, this is the real troublemaker. A high carbohydrate diet where you're getting the grain products without the vitamins can really wipe out B1. So that's a real problem. Now, what kind of B1 are you looking for? B1 is one of the fat-soluble vitamins, but there is a water-soluble B1 called Benfotiamine. And Benfotiamine can be absorbed without fat. It has a cousin called Thiamine. And in my patients who have neuropathy, we use Benfotiamine and Thiamine. And about 50% of my patients with peripheral neuropathy, supplementing them with Benfotiamine makes a big difference. Now, I'll do a little aside. We test all of our patients for what's called anti-GAD antibodies. Now, you've never heard of that, but anti-GAD antibodies are the autoimmune cause of stiff person syndrome. And you probably have heard of stiff person syndrome. And you may recall there is a very famous female singer who suffers from stiff person syndrome. And we see a number of patients referred to us with anti-GAD antibodies. And I've been very pleasantly surprised through the years, along with putting them on my program to heal leaky gut. All of these people are put on Benfotiamine and Thiamine, and I'm pleased to report that we've had very good success with eliminating these anti-GAD antibodies. In fact, just yesterday, I was pleased to report to an actress who came to me with this problem with a pretty high anti-GAD antibody that she no longer has anti-GAD antibodies. And this was actually in a pretty quick time. Was it the diet? Yes, but we also gave her Benfotiamine. So, should you take vitamin B1? If you consume alcohol on a regular basis, the odds are you are probably B1 deficient. If you eat the standard American diet, which is ultra-processed foods, you're most likely B1 deficient. Now, should you just take B1? Again, if you actually have neuropathy, I think adding something like Benfotiamine to your supplement regimen makes a great deal of sense. What's the dose? Most Benfotiamine is available anywhere from 250 milligrams to 600 milligrams. Most of the time, 300 milligrams, which is easy to find and it's quite inexpensive, is usually the dose we start with. And again, there's plenty out there. It's not an expensive fix. On the other hand, if you want to cover your bases, get yourself a multi-V vitamin that contains all of the B vitamins with one proviso, two provisos. One, these B vitamins often cause upset stomach in women. It makes them feel queasy. So if you're looking to take a multi-B, there's both B50 and B100. B50s are 50 milligrams or micrograms of all the Bs. B100, as the name implies, is either 100 micrograms or 100 milligrams of all the Bs. If you're a woman, start with the B50s. This does not fix methyl B12 deficiency and methylfolate deficiency. So you got to be careful with your B vitamins of what you're trying to address. If you have peripheral neuropathy, then really consider adding Benfotiamine and or Thiamine to your regimen in addition to that to make up for that B1 deficiency. All right, so that's all you probably ever wanted to know about thiamine and vitamin B1, when you ought to consider taking it, and if you've been diagnosed with stiff person syndrome or if you've been told you make anti-GAD, that's GAD, and it's a simple blood test, really consider adding Benfotiamine to your dietary program.